So the first video I watched was about therapeutic communication. The question asked, what non-therapeutic communication style did the nurse use in this scenario? What therapeutic communication styles could the nurse have used instead? So some of the non-therapeutic communication styles the nurse used in this scenario was using blank facial expressions. She had a serious tone of voice and had a very close body language. Some therapeutic communication styles she could have used were paraphrasing things different, along with offering herself to help him get over some of his defeats. Video 2 was about HIPAA. What should the nurse do in this situation? Even if it wasn't me who did it, or even if it was, I would apologize right away and go take it down. I would notify the charge nurse about the incident and have them take it up with whoever deals with HIPAA violations. Explain what had happened and let the nurse explain what led up to it and explain her story. Then there would be follow-up with any disciplinary actions and explain to the nurse any additional educational information about HIPAA. And then the other questions that we were supposed to answer is the first one: what therapeutic communication techniques are you most comfortable using? I would say I'm good at listening and clarifying what the patient is saying. It helps me get a better understanding and insight into how they are really feeling. When should you use therapeutic communication when caring for a client? I would use it when I'm trying to provide education and support to my patients. I feel like that's when they need it the most because they're learning so many new things. What are causes of urinary retention? Some causes can be constipation, any new medications that are used, infections, swelling, and surgery. What assessments are a priority when a client has urinary retention? I would use the nursing assessment. So what have led up to the point, and do a lower abdomen exam. I would also prioritize the quantity and how frequent that is happening, along with looking at the urine's color, odor, and anything else that must deal with the urine. What nursing interventions would you use when caring for urinary retention? I would provide privacy when the patient is urinating, because I know I wouldn't want someone watching me going pee. Also remind them to void every so often and encourage them to drink fluids, because pushing fluids is a big thing. Placing the patient in an upright position will help as well with the urine going down. What examples or example of HIPAA violations stand out to you the most? Mine would be gossiping and sharing are a big one, because there's no need for it. If you're becoming a nurse and you like to do those things, this really isn't the career for you to be in. Patients should feel protected and secure that their nurse will take care of them to their best of the abilities without them gossiping or sharing everything that's happening with them. Also, having a lack of employee training is surprising to me, because there should always be new training every so often, because things tend to change over time, and I feel like so will HIPAA. Is looking at your friend's chart a HIPAA violation? If you're not your friend's nurse, then I think it is against HIPAA violation. Overall, they might not want you to know what is in their chart, and if there's no reason for you to be in it, then it would be a HIPAA violation. How will you handle the situation? You are working on a unit, you see your friends come in as a patient. Will you go visit your friend? If I'm working on a unit and I see my friend come in as a patient, I will say a light hi, but I wouldn't go visit just as they got in. That can be a lot of stress coming in a unit and you see someone you know, so you think you must explain everything that happened to you. So I wouldn't go try to visit them right away. If they ever request me, then that's a different story. I would go in and just make sure they're okay and that they are comfortable.